right, our number looks like it's slowed down, so we'll go ahead and get started. Good afternoon, everyone. Welcome, bienvenidos. For those of you who want to continue in English, please stay put.
Las personas que desean escuchar la versión en español, por favor, elegir el idioma oprimiendo el botón en forma de círculo donde dice español en la parte inferior de la pantalla. Gracias.
Thank you, Tiffany. And again, welcome and good afternoon to our live attendees today. We are grateful you have joined us for our webinar, Student Voices and Advocacy for Student Mental Health. I am Molly Streer, and I am one of the hosts of our webinar today. I use the pronouns she, her, and I'm a white cisgender female in my early 40s with chin-length dark brown hair. I'm wearing a black top and my background is blurry. I am the School Counseling Program Coordinator in the Department of Counseling here at San Francisco State, and I am one of the co-investigators for this project. I am working alongside the project's primary investigator, Dr. Julie Chronister, who is the coordinator of our clinical mental health counseling program, and my co-investigator, Dr. Tiffany O'Shaughnessy, who is the coordinator of our marriage and family therapy program. I would also like to introduce and thank our graduate assistant, Sarah Guerrero, who is supporting the technical aspects of our webinar today. And I would also like to thank our other project assistants, Kiana Day Smith, Lennon Fanning, and Jace Perry for their ongoing support of our project. I would like to acknowledge that SF State's campuses in San Francisco sit on the ancestral homeland of the Ramaytush Ohlone. We further acknowledge that we work and live on the ancestral lands and waters of many other Indigenous peoples and nations. We are committed to ensuring this webinar is accessible to our audiences. Closed captioning is available in the closed captioning option at the bottom of your Zoom screen. If at any time your access needs are not met or become not met during the webinar, please send a chat directly to a host or a co-host. Access is always a work in progress, so we appreciate your comments, feedback, and support. This is our third webinar of the year sponsored by our Equity and Justice-focused Integrated Behavioral Health Counselor Training Project, which is fully funded by the Department of Health and Human Services, Health Resources and Services Administration as part of an award totaling $1.9 million. A couple additional things before we begin. If you are one of our HRSA stipend recipients or are interested in receiving continuing education units for your attendance today, please pay close attention to the announcements provided in the chat for sign-in and evaluation links. As a reminder, this is a live recorded Zoom webinar. Therefore, the audience is not visible and the audience cannot turn on their video or audio. The chat function is available for comments, sharing of resources, supportive emojis, etc. To ask the presenters a specific question, please post your questions in the Q&A function. Given that this webinar is a panel format, our Q&A will occur during the last 15 to 20 minutes of the webinar. So please post your questions in Q&A as they emerge, and the presenters will answer them at the end of the webinar. We are joined today by a panel of incredible behavioral health and education advocates from the Youth Liberty Squad with the American Civil Liberties Union of Southern California. After introductions, our panel will collectively present an overview of their advocacy work, and then we will engage in a facilitated question and answer session. Guiding this important work is Dr. Amir Whitaker, who is Senior Policy Counsel for the ACLU and the founder and director of Project Knucklehead, which is a nonprofit serving thousands of underserved and system-involved youth through educational, music, art, and mentoring programs. Dr. Whitaker is an advocate for youth justice, equity, and mental health, and I would like to express our gratitude to him for organizing this panel. It is with great pleasure that I introduce Dr. Amir Whitaker, who will further introduce our Youth Liberty Squad presenters.
Thank you for that, Dr. Streer, and thank you, San Francisco State University, for allowing us to share space and share some of the knowledge and information we've gathered. And big, major gratitude to our Youth Liberty Squad for joining us this evening. As mentioned, my name is Amir Whitaker, he, him, his. I'm with the ACLU of Southern California. And now I'll actually pass it to our Youth Liberty Squad students to introduce themselves. And maybe I'll pass the baton to students just so, there's a little more clarity. So let's start with maybe Liliana, if you're available.
Give me just 1 minute, please, if
No
possible.
problem. And I'm going, yeah, Liliana will be back in a second. So Danielle.
Hi, my name's Danielle Hernandez. She, her pronouns. I go to Azusa High School, and I've just
Cool. Thank you, Danielle. You muted at the end of that. We'll pass it to Hector.
Hello, my name is Hector Hernandez. My pronouns are he, him. I currently attend Azusa High School in Azusa. And yeah.
Cool. Thank you. And I know Jason might be out for a second. Sydney.
Hi, my name is Sydney Bergman. I use she, her pronouns, and I'm a senior at Downtown Magnets High School.
Thank you. And we'll pass it to Jason and Julio, who might be together or near each other.
I'm near Julio. Hi, my name is Jason. I use any pronouns. I'm a student at Venice High School in Venice, California, and I'm a senior doing the STEM magnet.
Hey, my name is Julio Aquino. Much like my friend Jason, who's sitting across from me, I'm also a senior at Venice High School in the STEM magnet, and I'm very excited to be here today.
Ooh, Venice High holding it down. And Liliana, are you able to introduce yourself now? If not, we can come back in a second.
Hi, my name is Liliana Degar, and I'm a senior at University High School Charter.
Awesome. Our awesome Youth Liberty Squad. So thank you all for joining us right after school. And thank you again to the professionals and students joining us as well. So some of the learning objectives, we're going to identify the current mental health needs of youth in California. You hear directly from students. Identify youth advocacy efforts to increase the access to mental health services and learn more about our, mental health as a civil rights movement, student mental health as a civil rights movement. And we hope that you'll be able to, learn some recommendations on how to provide accessible and effective mental health services for youth. So I introduced our panelists and myself as well. That's a picture of our earlier Youth Liberty Squad. And this is a picture of our current Youth Liberty Squad. You can see some of the students in there. And just a little bit more context about the Youth Liberty Squad. So it was created in 2019 to empower, inform, and advocate alongside students. And we have students from over 50 schools, bi-monthly meetings on Saturdays, or now monthly meetings, sometimes in person. And we do Know Your Rights workshop with the students, but they also do Know Your Rights workshops with other students. And they do advocacy, not just at the school level, fighting to change their schools, but also school district and state level. And now I just want to open it up and pass it to some Youth Liberty Squad students who, if you want to unmute and maybe share one of your memorable moment, one of your favorite moments or memories of the Youth Liberty Squad. And you can just, unmute and share as you're comfortable.
All right, I'll go first. So my most memorable moment in Youth Liberty Squad would definitely have to be like the team building moments. So like, I guess first meeting when we had team exercises, it helped me like really connect with everyone else quickly. And it basically brought us together in order to empower each other and bond together in order to advocate on a group basis.
Awesome. Team building activities. Anyone else want to share, or want to share maybe what that picture is of there, what happened at the picture?
Is it okay if I go?
Please.
Okay. So, well, going on to what Amir was saying and Jason was saying, I also really loved our team building moment where I think there was a time where we're building a bridge, or I forgot what it was, but it was it just helped us kind of connect more to the other people in our squad, and it helped us to communicate even though like we only meet probably like once a month. It really helps us create that bond. But one of my favorite things at the Youth Liberty Squad was when we kind of talked about mental health, which is what we're going to be talking about today. And even though it was kind of a really sad moment for some of us due to our experiences, it was a very heartfelt moment where we could share about our experiences and what are the issues that needs to be faced.
Thanks for that, Sydney. And maybe one more student if you want to share any highlights or what made you join the Youth Liberty Squad, because these are all students who applied. We received hundreds of applications, and we had about 50 or so students selected.
I think for me, one of my memorable moments would be, I think there's two. One of them would be the Christmas parties. Those always get fun. But we do a lot of activities, and it's like a really great way to bond with each other. But another memorable moment for me would be when I was able to attend the Models of Pride conference at LACC. We did a lot of like advocating for student rights and just like student wellness, for students to know their rights as an LGBTQ person, etc. And I think this was really fun. The students were really interactive, and it felt very like empowering, not just for us, but for them as well. And another really fun part of that day was after we were done, we went to the swap meet that was right in front. So that was like really cool to see.
Cool, man. Thank you for that. And thank you all for sharing. And I think one thing I'm taking away from that is the team building, because that's something that's not always in the objectives or outcomes, but just building that comfort space with students. You can never spend too much time on that. So ACLU, just throughout the years, a big part of our movement has been working with the school counselors and school counselor solidarity. I wish I was supposed to join the California Association of School Counselors Conference tomorrow in Monterey, but I have an event down here in Los Angeles. But as the bottom left shows there, our framing around this issue is like all students deserve access to school counselors. It's their civil right, and not just school counselors, but mental health support, mental and behavioral health support, wellness services, and other things. Because as you all know, if students don't have those services, then how can they function or prosper academically? So we think these mental health and wellness is just as important as mathematics or English or anything else that they're learning in school. And just a really quick timeline. Oh, I'm sorry. I meant to share this. The PowerPoint will be provided. Usually I put a tiny URL there, but it'll be provided because we won't have time to spend a lot on time on some of these slides. But here, this slide, for example, just shows our, student mental health movement led by students over the years, where we've done things highlighted in yellow, like the students submitted a letter and survey results to the governor and state superintendent, back 4 years ago. They've launched petitions for Arts Not Arrests and Counselors Not Cops. They delivered these petitions to state officials several times. And we actually just launched a new petition that we'll talk about. But students have hosted town halls. We've created fact sheets and reports and surveys and other things, op-eds, blogs, and other things that you'll actually hear from. And one of the town halls we hosted, this is an image of right here, where in Los Angeles, we're invited one of the school board members there to share space with us. And does any student want to share maybe one of their highlights and memories of this? Or Hector, you want to share something about this event?
Yeah, I think a really good crucial part of this event was just getting like student voices heard. That's not something that usually happens a lot, or when it does, a lot of the times it feels very condescending when like adults try to talk down to you. But I felt like this space like really allowed us students to get not only kind of convey what we need like for our own like wellness and student mental health and stuff like that, but the board members were really keen on listening on what our actual problems were, and they seemed like they were actually willing to do something about it. So that was kind of really cool. And another cool thing was when we also planted the tree for Tosh. That was something that we all did together, and it kind of brought us together as well. So that was really cool.
Yes, thanks for that. Yes, this is Tosh right here in the top right corner. He was a young artist and musician that we worked with, and he left us last year. And we planted a tree in his memory, because part of why he left us because his mental and behavioral health needs were not being met. And he was in his early 20s, and we have a tree planted here for his memory. So our students also were able to meet with the LAUSD superintendent and several board members after that town hall, and their specific solutions and policies that they presented to the school district. One of those, they're listed on the right there. So there's 11. One of them was, requiring health classes to teach mental health, which many of you know, the law changed and requires that, SB 224, but where the students themselves have not seen implementation of that. So it's really important to teach about mental health, right? In our core classes. Peer-to-peer programs were demanded by the students, substance abuse and behavioral support programs, fentanyl prevention and intervention, because unfortunately that's how we lost young Tosh as well. Clarification about the mental health days, which students will talk more about later. But on the left, you can see there the picture when we met with the superintendent and his Instagram post and tweet that he shared talking about support saves lives and different things and the impact it had on Superintendent Carvalho. Something else students just did, actually just a few months ago, one of the students who's on here, Liliana, in furtherance of this advocacy, because Liliana is a student within LAUSD, wrote and published this blog and op-ed that you can access through the PowerPoint, but I want to offer it to Liliana to maybe read or share some of the blog and maybe why she wrote it, and yeah, anything else she'd like to share.
Yeah, I'd love to. All right, so I wrote this blog called The Shocking State of Mental Health and Behavioral Services in California in 2023, because I feel like really in LAUSD, people's needs just aren't being met. A lot of people don't even know that they have access to services like that are related to mental health, such as like the school psychologist or school therapist. A lot of most students actually don't know that you could take days off of school for mental health or behavioral related issues. And I felt that it really needed a change. So, as it says at the top of the article, there is a brief content warning because it does discuss issues of mental health and depression, but I'll just get right into reading it. So, almost 3 full years after the Youth Liberty Squad with ACLU SoCal surveyed the state of mental health in California, little has improved. Both Governor Newsom and Superintendent Thurmond received a petition about the survey's findings, but many schools still face the same issues today: unrealistic attendance requirements, extreme methods of discipline, and lack of access to counselors, nurses, social workers, and other resources. School board members aspire to have an inclusive, comfortable environment in districts like mine, LAUSD, but the reality falls short. Many of the issues caused by the lack of funding given to mental and behavioral resources are reflected in my school. My school is one of the more fortunate schools in LAUSD with counselors, social workers, and psychiatrists. However, they're greatly limited. Nearly 400,000 students in California attend schools without a school counselor, despite having school police. In sophomore year, when my depression was at its worst, I was only referred to the school's psychologist after I had fallen apart. Most schools feel uncomfortable divulging personal information to our counselors because their rooms don't have proper walls or doors. This limits privacy and allows others in the vicinity to hear confidential conversations. Our school nurse was on campus 1 day a week. If you were injured on any other day or experiencing physical symptoms of a mental illness, you are out of luck. Access to professionals increased in my junior year when psychologists and wellness center staff were brought to campus. Unfortunately, they were still insufficient to serve our large student body. On more than 5 occasions that I visited the social worker, he was busy in a meeting or patrolling the campus to prevent student misconduct. The same scheduling conflicts frequently occurred when I tried to meet with my counselor. Conditions and policies within the school often add to the stress and anxiety students experience. Some teachers at my school take off points from participation or give detention to students who use the bathroom during class time. These policies are used to prevent students from skipping class, but they are very harmful to students who are disabled or have mental health needs. Students are expected to use the bathroom between periods. However, on the upper portion of a campus, there are only 3 bathrooms open per gender for over 1,000 students. By using the bathroom outside of class time, students risk being tardy due to the extensive lines. So many simply dehydrate themselves for the whole day. Imagine how this impacts the students' wellness. In addition to this, many students feel discouraged from seeking help when they're struggling because they believe they'll anger their teachers and they won't succeed. In 2022 to 2023, I missed 14 days in the first and second semester because of severe physical illness, but I still maintained my 4.0 unweighted GPA. Despite these absences being excused by medical professionals, I was denied from being a service worker at my school, where I would have assisted counselors because it was part of LAUSD district protocol. Hearing that I, among the top students in my grade, was disqualified from performing simple duties by something completely out of my control was very disheartening. Instead, a holistic approach to reviewing students' performances should be used, but this is not the case at LAUSD at the moment. Oppressive policies such as not allowing students to leave class or using attendance as a metric of academic ability make students feel as if school is not the place for them. Coupled with 30% of schools in California lacking a nurse, counselor, social worker, or psychologist, students seeking help may feel as if giving up on school is the easiest option. This is why organizations like Dignity in Schools have been organizing a national week of action against school pushout for over 12 years. Thank you.
Thank you for that, Liliana. Thank you for writing that. Thank you for being open and sharing those different things. And thank you for connecting dots between something like being able to access a bathroom, right? To the wellness of students, or being treated fairly and not penalized for something, like you said, for things out of your control. Thank you for that. I want to offer it up briefly to any other students if you want to share, and we'll have other times for students to share. If you want to share any reflections on that, anything that resonated with you, or anything that you've experienced similarly that shows the shocking state of mental health and behavioral services in California. And then also, if any students came a little later and didn't introduce yourself, please introduce yourself now as well. All right. Cool. We'll go to the next slide. Which actually is more students sharing as well. So Liliana talked about the surveys that we administered, the new surveys, but also previous surveys that we delivered to the governor and other state officials. We just launched another one, and one of the things we asked students was to share, we just leave an open-ended area for students to just share what you're experiencing, what's going on, or anything. And of course, we include resources and links and disclaimers and that sort of thing. But I want to offer it to Danielle to maybe read some of the quotes from students about their experiences and what they shared in our latest survey that we started administering last year.
Yeah, absolutely. So here are just a few quotes from like the survey that we conducted. First of all, one of the quotes says that barely anyone knows if there's any services at their school. And like I could relate to this on a personal note because I just recently found out that we had a well-being center that you can go into where like you like just talk about like your mental health and they'll like help you and they'll provide you with resources. But I honestly didn't know about this and we're almost like done with the school year. And apparently this has been a thing for all 4 years of high school. And I'm a senior now and I didn't even know about it up until about last month. Another quote says that our school is also known for our rigorous program, so the majority of people in our school are highly stressed in some way, but we don't have any type of support regarding a student's mental health or other than focusing on tutoring services. And for me, I'm an ECP student at my school, which means early college program. So it's kind of like dual enrollment, where you take college courses in high school. And I'm also a student who takes AP courses. So my workload could be very heavy. So I can understand like where the stress comes from. And like around my school, we have a lot of tutoring services. There's constantly posters up about like where you can get tutoring. And like they're always like teachers always kind of let us know that there's tutoring opportunities. But like there's no really like mental health services. Like if you're overwhelmed or too stressed, like they don't really provide you with that sort of like help or support, which honestly I think could be that could have like a very negative toll on like students who don't really have a healthy coping mechanism. And then finally, a last quote that I feel like sharing is absences at my school are not excused for mental wellness days. And for me, that's like, it's a very serious thing because I didn't even know we had mental health days, and neither do a lot of people. I barely learned about it through YLS because this is something that they mentioned to us. And while I don't personally, I have not yet taken mental health days, I know that there are a lot of students who would like benefit off of taking mental health days. And instead of taking mental health days, they kind of just take the absence, or they just like end up in trouble for taking that absence. And I feel like if this was a known thing, if mental health days were very like widespread and known, that more people would not have to take those absences.
Yes, thank you for that, Danielle. And agreed, not only, when students are not given access to their mental health and wellness days, not only is that wrong, but that's an injustice and that's a violation of student rights. And it further stigmatizes mental health, right? And we need to give students that grace. That's why the law was created for that. But like Danielle mentioned, many students do not know that that right even exists. Most students actually, as the survey data shows that we'll explore later. Now I want to pass it to Jason to share a bit about some of the other data, the more quantitative data that we found in our survey. Jason?
Okay. All right, thank you. To give a bit of background towards our survey, we push out this anonymous survey for students to take around November or October. And it primarily is from students from the Los Angeles area. In grade level wise, most of the people who have taken our survey are in high school, and gender wise, the majority of them are female, with male and non-binary students coming later. Result like afterwards. For some results from our survey, in the past year, where did you get help from a counselor or therapist? An overwhelming, alarming 60.3% of students stated that they have not received any help from a counselor or therapist, which is extremely alarming. If there is a need for mental health services, students may not be able to get them, or students may not be able to receive access with them. However, 20.5% of students received services at school, with 12.3% coming from a counselor therapist without school, and 6.8% of students stated, "I don't know." Results from, has anyone personally asked you about your mental health wellness over the past 6 months? An alarming 35.1% of students stated no. However, 50% of students stated yes, a friend. So it seems as though friends are at least helping students with their mental health wellness. However, at school, the results are kind of worrying, at least in terms of family members, teachers, and counselors. So within our schools, we definitely need an emphasis on the mental health services, or just people to check up on student mental wellness.
Yes, thanks for that, Jason. And, as mentioned, the fact that over half of students, or about half of students, 35% of students did not have anyone ask them personally about their mental health in 6 months is very alarming. Basically 1 out of every 3 students, right? And it just shows the importance of just checking in with students when possible. And then also giving our professionals, our mental health professionals, our staff at schools, the opportunity and the space to do so, right? As Liliana shared, 5 times in a row, she tried to access her school social worker and she could not, right? So we know it's part of the problem with the system. But when 1 out of every 3 students are not receiving anyone checking in, I mean, even at home, right? A family member, I think that shows we even have to do different trainings for families to create that comfort zone for them to check in with students. So another question we asked was, when it comes to supporting your wellness, we just asked students, if they were receiving counseling or therapy before the pandemic. About 15% said they were. About 16% said they received counseling or therapy, after the pandemic for the first time. So about the equal amount. And about 45% said they had never received services before the pandemic, but they could use services. 18% said that they had never received counseling or therapy before the pandemic, but they think they need services now, right? So that's a large percentage of students. And when we've done this survey in previous years, it was actually the first time in 2020 during the pandemic, about half of students said they could use mental health services. So it's good to see that go down. But the fact that still 18% of students are not receiving, student mental health services or support in their school and could use it is alarming. And we also ask students, to your knowledge, what mental health resources do your schools provide? And some were aware of counselors or psychiatric social workers, school psychologists, therapists, wellness centers, and others. We had open-ended responses for them to add in. But we understand there's a diverse array of mental health professionals and support that schools can provide. But many students are not aware of some of the basic ones. And now I want to pass it to Hector to talk about some other important questions we asked students. And this was the first time in this year's survey that we asked these questions specifically.
So one of the more alarming questions that we did ask were, have they ever heard of the 988 hotline, which also is known as the new suicide hotline because they changed their number. And an alarming amount of students said no, which was almost 25%. And I feel that personally, like if a quarter of the student population does not even know the new suicide hotline or where they can get like mental health resources, that is very alarming because like there's definitely like I've known people that have committed suicide, and that's like something that like when people are up to that point in their life, they like desperately need help, and not even knowing where they can get help is just not okay, and there's not enough resources for them to like even know where to go. But 65% said they did know, and 10% said that they maybe, which meaning like they probably heard it, but they didn't know what it was, or they just were confused on what the 988 hotline was. So that is still a very large amount of number. And then for the other question that we did ask was, did you know that California students have received excused absences for mental health days? And almost 80% said no, which is also alarming because like Danielle said earlier, sometimes a lot of students just take the absence, or they just like end up going to school because they're like, well, I don't want to miss instruction. My teacher's gonna get mad at me. I'm gonna lose participation points. I'm gonna do this and that. And it kind of just like constricts students into the like this idea that, well, I have to be at school because this, or my mental health doesn't matter because school comes first. And I feel like by destigmatizing like this ideology, we can better help students not only do better at school, because better mental health will of course increase your kind of how you do in academics, but just like overall just allowing students to understand that there is other possible ways of kind of unwinding and finding different ways to kind of still do good at school and also prioritize yourself. And that kind of ties into like the last question of how comfortable you are in seeking mental health resources. And like the majority of students were like very middle about it, and there was a very few amount of students that did say that they were very comfortable, and then also on the other end of the spectrum, there's other students that said that they weren't comfortable. And this kind of just goes to show how this number should be on the 4s and 5s, like the majority. But again, kind of talking about destigmatizing this ideology of like mental health. A lot of students just don't want to seek mental health either because they're embarrassed. They think they're gonna get reprimanded. They think this and that, and that kind of comes personally for me as well, because I know sometimes I just don't want people to look at me different or think that, oh wow, you're seeking mental health resources, so you can't do this, or you're not smart, or you're this, or stuff like that. So kind of being able to destigmatize mental health and like actually being able to seek these resources will overall just help students a lot in the end.
Yes, thank you for that, Hector. And this is why we create resources and materials specifically for this. And I'll share some of that later, but our My School, My Rights website that the ACLU SoCal created informs students about their rights. Because what's the use of creating these rights, getting the legislation, getting the law changed if students aren't aware? If 4 out of 5 students aren't even aware that they can actually access this, or students don't know that they should call 988 instead of 911 when if they're having a crisis, or even text. I think that's really important, right? I think if students knew that there's a hotline that they can text for suicide support, that was created to access this generation more and create a more comfort space. But many students are just unaware of this. And just some of the other questions we asked was, which of the following have you experienced in the past year? And we gave a laundry list of Behaviors are different things, whether it's lack in motivation, which 86% of students resonated with that. About 80% of students said they felt overwhelmed. And then alarming, about 7% of students said they acted on or sought help for suicide. And we know that's an increasing number, but 66% of students said they had an emotional meltdown. So we're still seeing a lot of these behaviors come up, and many students aren't having them addressed. Then we also asked students another question dealing with stigma. If you were sad or stressed, would any of these stop you from talking to a counselor or therapist? And we just gave a list of some common things that are the reasons why people don't seek mental health support. Or students specifically, we asked, like, if their parents might find out. That was one of the lists, and that was the most common one. About 40% of students said they are uncomfortable seeking support because of that very issue. Some said, they don't want to talk specifically. Many said that, people wouldn't understand or that their friends would find out. So this shows that stigma, we know stigma is an issue and we can't just talk about it generally, but we have to get into the specifics of why are students afraid or not comfortable seeking services. Now I want to pass it to Danielle. I'm sorry, that this is actually the chart with that. And I'm sorry I shared a bit of that. This was the chart from the findings from the previous years, and Danielle can share that and some of the most common things, and also just speak specifically about if anything with stigma, how it might impact her or how she's seen it impact her friends.
Yeah, absolutely. So like Amir said, this chart is just talking about what students would do if they were sad or stressed and the things that would stop them from talking to a therapist or a counselor. So the first thing I would like to point out is that almost like 30% of students didn't want to seek help because their parents would find out. And I could definitely relate to this on a personal level because I have very traditional Mexican parents and they kind of don't believe in mental health in a sense. And so like I knew if I was ever in a situation where I was stressed or sad and I needed somebody to talk to, like I would be more likely to seek out a friend than I would professional help, just because like if I were to go talk to somebody, a professional at school, and they were to contact parents, like that could have a negative impact. And that isn't necessarily something that I would want or like a friend of mine might want. So I definitely don't think that that would be my route of choice. And I think that's the case for a lot of people. Like I know a lot of my friends personally would rather just talk to a friend of theirs or like a trusted teacher instead of like an actual counselor or therapist, just because they kind of want to avoid that impact that talking to a professional would have. And then another thing I would like to point out is how almost 20% of students don't even know where to get help if they wanted it, which is very alarming that we don't have the proper marketing to go and allow students to know where to find the resources when they really need it, because there are a lot of students who genuinely need professional help because they're stressed out in school or they're stressed out with something in their personal life, and not knowing where to look for these resources can really like have an impact on students. And I think that it's important that we start to like market mental health resources better, because that way we can just kind of like lead.
Yes, thanks for that, Danielle. Putting the story and the voice to some of these things. And again, we can't just increase services. We have to actually increase comfort and access in these services. And now maybe Sydney, if you're available. One of our students, Angelina, created this Break the Stigma campaign. She was part of our second Youth Liberty Squad cohort. She's about to graduate college now, but she created these Break the Stigma stickers. Sydney, if you're available, maybe you could share some of this and also share anything that you've experienced or seen when it comes to stigma and seeking services.
Yeah. It's okay if I read it, right?
Yes.
So one of the main reasons I applied to YLS was because I heard about the work you guys did regarding mental health. This is a topic very close to my heart. During my sophomore year, there was an incident that my family and I unfortunately witnessed. Following that, my mental health really took a fall and I began suffering from anxiety. I was lucky enough to have my counselor just sit and listen to me, to all the pent-up feelings I was dealing with, what happened, stressing with my rigorous course load, feeling isolated from my peers. it was after talking to someone that things did start getting better, and I definitely felt less alone. So what Angelina said, it's really important that we have access to mental health services, and it's important that our school has access to them, and it's important that us students have the comfort to even just go up to adults that can help us. And more things that she said was, I was fortunate enough to have a school counselor who cared enough to listen. Anxiety is still a part of my everyday battle, but my mental health is so much more better than it once was. I realized that so many people in my community suffer from mental health issues, but because of that stigmatization, particularly in my community's case, that traditional Hispanic mentality of keep it to yourself, machismo, no one needs to know your business. So really do reach out. I know so many people self-medicate with drugs, marijuana, and vape, and violence, etc., because that's how they cope instead of asking for help. So I kind of relate in a sense because during my junior year, I never really felt, let's say, anxiety. I never had a panic attack, but junior year was really hard for me just because of the course load. And I also, coming from an Asian background with my parents being Filipino, there's this stigma with mental health and they don't really believe in it. And seeking out help with a psychiatrist or a therapist, it felt like there was something wrong with me, even though there wasn't. It's important to have like a therapist or even a counselor to talk to you about your mental health because it's so important. It starts deteriorating, let's say your course load, and that's how it kind of even it deteriorates more of like your mental health. And there's this whole perpetuating cycle of suffering, and we need to stop that. And uh I'm fortunate enough to have a school psychiatrist at our school, but also I'm a peer health advocate, and in our well-being center, it's very far from our my campus, and that's why most of the students at our school don't even know that we have a well-being center, and it's important that proximity of distance is regulated, and I feel that's the need that we have to fix at my school, even though we're fortunate to have one. And I'm also lucky to have counselors at my school that I could talk to and adults that I can trust about my feelings.
Yes, thank you so much for that, Sydney. And just speaking truth to power. And many communities, like you mentioned, the Filipino community, students mentioned Mexican communities. I remember when my niece needed help and the counselor told her mother that she was displaying symptoms of anxiety, specifically social anxiety. And the mother responded by saying, well, mental health is a white thing, right? But we know even within the white community or different white communities, right? Mental health is stigmatized there. We have to really we have to normalize seeking help and receiving support, and there are different ways we can do that. And this student, we gave out hundreds of these stickers that say, break the stigma with Angelina's art. So thanks for reading that, Sydney. And one of the last things we'll share before we open it up for questions, an article that was written, and it's linked in the PowerPoint, but it talks about, the title says, When Children Suffer, California to Funnel Billions into Mental Health Overhaul. And it featured another one of our Youth Liberty Squad students named Amanda there hugging her mom. And I want to pass it maybe to Julio to read a bit of text from this article that talked a little bit about Amanda's story and her parents and some of the stuff she experienced. Because as we know, there's a spectrum of needs that students have where some could just, use some support with their wellness or different things, right? But some students have, multiple diagnoses or conditions that they need support for. Julio, are you able to read this text?
Yeah, of course. Amanda Arellano felt a heavy weight pressing down on her chest. It was May of 2021, and the teenager struggled to breathe. Maria Arellano rushed her 17-year-old daughter to the pulmonologist. Amanda had cerebral palsy, autism, epilepsy, asthma, and a heart murmur, with COVID on the prowl. They couldn't be too careful. This wasn't an asthma flare-up, the doctor told them. This was anxiety. Sitting in a Jack in the Box near their home in Boyle Heights last month, Maria's eyes filled with tears as she searched for the words to describe watching her normally gregarious daughter struggle. It makes you feel very powerless, she said. Many California parents know this feeling very well. 2 years into the pandemic, our children are in pain. Rates of anxiety and depression have shot up so quickly that several national leaders, including the US Surgeon General, have issued urgent public health advisories. School-based therapists report long waiting lists and an increase in fighting and behavior issues. Emergency room doctors say that they are overwhelmed with the number of children coming in after trying, one second, there's a notification, to harm themselves. On top of this, the state is facing a shortage of mental health providers.
Yes, thanks for reading that, Julio. And there's more text included in there. We just don't have time to share it today. But Julio, while you're speaking, is there anything else on the topics that we've shared so far that you want to add to, whether it's mental health stigma, whether it's access for some students, like Amanda, or anything else?
No, not from my experience personally here at Venice. I feel like we're very fortunate to have programs such as Margaret's Place that are very available to our students and very well advertised and very normalized for students to go there.
Nice. Well, tell us a little bit about Margaret's Place. What's that?
So Margaret's Place is like this counseling place we have on campus, and any student is welcome to walk in there, even during class time. And it's confidential, right? And that's pretty much the gist of it. Yeah.
Awesome. Thank you for that. Yeah, and that's a model for what can be done or what should be done. All right.
I think Jason is more well versed in Margaret's Place. So I think he might want to elaborate. I see he's
Yeah,
over there
Jason, please.
looking like he wants to talk.
Yeah. So Margaret's Place, basically the gist of it is that they emphasize anonymous. So you can anonymously ask if you can go to Margaret's Place during the class period, and it kind of like destigmatizes like mental health services. Students don't necessarily have to fear about whether or not they have to like come out and to their teacher and say, hey, I need mental health services, can I go to this class? They just have a summons to go to Margaret's Place and are able to talk about their mental health. So I think we're really fortunate to have this type of program. However, I know that in other schools, especially those in my area of South Central, my local area, we sometimes don't necessarily have that type of services, or it's too stigmatized in order for students to even access it.
I also want to add on to the fact that we have something called the Mental Health Advocacy Club that has also helped normalize and destigmatize mental health here. So recently, just today, they were doing a tote bag giveaway where you filled out a survey and you would receive a tote bag, and the survey would ask questions regarding mental health. And I thought that was a really good way to collect quantitative data to be able to communicate the needs of our students on campus.
That's awesome. It's great to hear about that happening there at Venice. And yeah, maybe we need to get some tote bags to get our survey percolating as well. But thank you all for sharing that. Margaret's Place sounds like a safe space for students. And, and it sounds like at Venice High, at least, you all are aware of this safe space and you have the right to access that. But as we've heard and as we know, many students don't have that awareness and many students don't have that safe space. Right. And our My School, My Rights website, which is just myschoolmyrights.com, has several modules for student rights, whether it's students with disabilities, LGBTQ, plus, whether it's students who are unhoused, whether, students interacting with school police and other areas. And one of the areas we have is student mental health rights. And there you can see some of the questions we clarify and provide information and even law on to let students know about their rights. Like, what kind of supports can I receive in my school? Who can provide supports? Should I be learning about mental health in school? And we talk about the law that they should be required to learn. And we talk about mental health days and other things that students should have access to, because as we shared, many students aren't aware of these. So please use our resource at myschoolmyrights.com to find out more about that. I'm going to stop with the survey data because I feel like we actually shared enough of that, but I'll just share, that our students met with the State Board of Education, met with the California Department of Education and others related to student mental health because of their advocacy. And we've submitted a letter to the governor that can be linked there as well. And you can see the California Association of School Counselors was a major partner there. And last thing I'll end on before we just open it up for general questions and answers with students, and our call to action for you today is, we're working in Long Beach with students to advocate for more counselors specifically and other things, because in Long Beach, they have one of the highest student to counselor ratios in Southern California and then across the state. So we've hosted town halls every year for the past 2 years, and that's those flyers right there. And we have a petition going that you can sign by accessing the QR code right there as well. But we just want to encourage you all to sign and support and learn more about what some of the demands that students are raising for school counselors, and not just to access school counselors, but how, right? With them being available and not just supervising during lunch, right? Them being available before and after school, and just different opportunities when possible. And for the school counselors themselves to not have so many administrative duties. And we know it's not just school counselors, but other professionals in schools often have administrative duties that take them away from providing the mental health and behavioral health support and the wellness support for students. And now with that, we can, pass it around and open it up for questions and have more of a discussion for these last few minutes. And we have some questions as well if the audience does not have questions.
Right, thanks. And I'm filling in for Dr. Streer to facilitate the Q&A portion. So hi all, Tiffany O'Shaughnessy. Thank you so much. It was amazing to hear from you all about all of the advocacy that you're doing. And I've seen the chat, people were so excited about that, but also just even within your experiences at the different schools you're at to hear about the disparities that exist out there and the ways that you all are working to change that. So really appreciate it. And we're gonna take that call that you just did and follow up on that. We did have one question that came in. And it also, part of something that I was really struck by was, understanding, the one of the barriers, one of the stigma pieces was not wanting your parents to find out. But the second highest one was the counselor or therapist wouldn't understand me. And that feels like a big thing that our field really needs to be working on. And so one of the questions that came in from the audience was, in regards to students and their experiences with mental health crises, for example, suicidal ideation or panic attacks or social anxiety, if you feel comfortable sharing, do you feel that your school counselors are adequately prepared to support you during a crisis, or at least connect you to the right services? And what are your fears or concerns of sharing how you're feeling with counselors or school staff?
Yes, Liliana.
Okay, yeah, I actually have an experience to share about that. So even the most trained mental health professionals in school, unfortunately, are lacking in some areas. So I already explained in my in the blog how it's very difficult to talk to counselors because basically everyone can just hear what you're saying. So that's definitely one of the biggest barriers. But the other problem is I've kind of seen it demonstrated that they don't always understand you. So one day I was having a really rough time because I normally take a medication for my ADHD called Vyvanse, but there was a shortage, so I was unable to get it. So I was really exhausted. I kind of wasn't feeling like 100% like tip-top shape. And I went to go talk to one of my school therapists, and I was just talking to him for a bit. And he wasn't even like really nodding or saying, He was just kind of like sitting there, it's completely silent, looking at me. And his responses didn't seem like he was really understanding me at all. And rather than saying like, "Oh, I understand how you feel, that must be really frustrating," he just asked me about my coping. He said, "Oh, well, what coping mechanisms can you use for this?" Which I already know, like I'm very familiar with, but he didn't really offer any reassurance or any sort of like comforting words at all. And then he said, "Oh, it looks like those girls outside need me because like there was a girl outside crying. Like have a nice day," basically. So I kind of got like sent out of his office, and I had been in there for like less than 5 minutes. So there are some really frustrating experiences, unfortunately, with these people. And I understand that they're trying their best, but I'd say definitely there are probably a lot of students who have had an experience like mine and just never gone back.
Oh, that's really, really sad to hear such a deep failure of empathy there. And then just, kind of kicking you out while you're not having access to your meds and all of that. Jason, I think you were maybe going to also say something in response to that. Did I see that?
Yeah. So in like the second response, the second question, what are your fears and concerns on sharing how you're feeling with counselors and school stuff? Um, for me, before we had like mental health advocacy club and like there was a lot of people started to know about Marcus Place. For me, especially in my experience, the biggest fear I had was mandated reporting. It was like the concept of mandated reporting was kind of unclear to me. So it felt as though if I opened up, it would end up being reported, or it would end up having to be told to my parents, and that kind of pushed me to not seek mental health services. However, at least in our school, we're trying to bring clarity to the concept of mandated reporting. But I know that a couple like schools throughout LAUSD and throughout the nation need to provide clarity for mandated reporting, or need to provide better clarity to it.
Yeah, that's really good advice. Anyone else have things they want to share related to those questions?
And then I also saw another Q&A pop up for some school sites. There are resources available, but students do not know them. Do you have any suggestions on how to advertise to students about available resources? So in my experience, at least in our school for Mental Health Advocacy Club, I mean, events where students are able to interact with probably mental health professionals or people within organizations meant to help students. So for example, the tote bag event at our school really was able to bring in data for resources and really advertise the type of services that we have in through surveys, because they put out information and students are able to view the information before they're able to make tote bags. In addition, it was kind of a team building activity, or a kind of bring together type of activity in which students were able to talk to other students potentially about mental health, or potentially about other subjects. So for advertising purposes, I think trying to get students together is really a powerful way to advertise services available to students.
Adding on to what Jason said about the mental health advocacy event, I feel like the quantitative data that's collected during these events really help our mental health professionals know what's working and what's not working. And we get to see as the year progresses when students are more stressed or depressed. And I feel like this data is something that our mental health professionals know how to utilize very well and respond to.
I'm curious, Danielle, I know you had mentioned that you just found out, even though you're about to graduate, you finally just found out that there's this wellness resource at your campus. So how did you end up finding out about it? Well, and so that we can know how to do that with freshmen.
Yeah. Uh, so within the wellness, or we call it the well-being center. Within the well-being center, they have like, it's kind of like peer mediation in a sense, where they have other students come in. So if like a student goes in seeking mental health, and they just really don't feel comfortable speaking to like an adult about whatever they're going through, they train students to kind of talk them through the situation and kind of like help them out the best that they can. So I had two friends who like were trained in that, and they work on the well-being center, and that's kind of how I found out, because they would always talk about like how they would have to go to a well-being center, how like they were doing in like their training. So that's how I learned. But I feel like as far as marketing goes, I feel like the best place to like put stuff out there is like social media. Like almost all student populations on social media, and so like if you can put that on your school account, or like my school has like ACLU accounts and a bunch of random different like club accounts, you could spread that around and like make flyers.
Gotcha. Thanks, Danielle. And then Sydney, I think we're at the end of our space, but Sydney, you can get the last word. I see your hands up.
Sure. I'm fortunate to have an ASB, so I'm part of ASB, and what you can do is also collaborate with other clubs, and I think it's also a good way to talk your peers into helping each other and how to raise awareness for your mental health center, or even also being a peer health advocate. We're actually trying to get our principal to set up a meeting for our whole school. And I think just collabing with if you have like a student body, or even with other clubs, that would be really great.
I love it. So we've got giveaways, social media, collaborate with the students, and really just be out there and just, yeah, and let people know. And then when you do let them know, listen well, be like, and do your best to connect with and support the students who do fight the stigma and come in and make it there. Y'all, thank you so much. We have learned so much from you all today. We're so appreciative of the work that you're doing. And we'll keep doing our part to try to train more counselors so that so that this can help shift. So all of us working together, hopefully we'll make some changes. You're getting a lot of love and thank yous in the chat and all around. Thanks to everyone who came. Like they said, the slides will be up on our website. This will be posted to our YouTube channel so folks can access it and see it. And so, yeah, really appreciate you all again. Hope everyone has a wonderful rest of your day, a good weekend. And yeah, don't forget to come to our next webinars. Take care, everyone.